Have you ever been jolted awake by a painful leg cramp that had stopped you in your tracks? These sudden, involuntary muscle contractions can be agonizing, but what exactly causes them? In this video, we'll break down the scientific reasons behind leg cramps, sometimes called a Charlie horse, reveal the top 6 foods proven to prevent them, and 5 lesser-known prevention methods, and show you exactly how to stop a cramp in its tracks. Chapter 1. The science behind leg cramps. Leg cramps occur when a muscle suddenly contracts and can't relax. Leg cramps can result from a variety of factors. Factor number 1. Physiological stressors. Overexertion, prolonged exercise, or poor conditioning can lead to muscle fatigue and cramping. Factor number 2. Electrolyte imbalances. Your muscles need key minerals, potassium, calcium, magnesium, and sodium, to contract and relax properly. When levels are off, muscle function is disrupted. Factor number 3. Dehydration. Loss of water and electrolytes during intense physical activity or heat exposure increases the risk of cramping. Factor number 4. Poor circulation. Reduced blood flow can cause muscles to spasm due to a lack of oxygen and nutrients. Factor number 5. Neurological factors. Overactivation of motor neurons or dysfunction in sensory neurons can lead to involuntary contractions. This is especially true for idiopathic cramps, those without an apparent cause, or cramps associated with neurological conditions like multiple sclerosis or nerve damage. Factor number 6. Medical conditions. Conditions like diabetes, kidney failure, cirrhosis, or peripheral artery disease can contribute to frequent leg cramps due to metabolic disturbances or poor circulation. Factor number 7. Age and lifestyle. Older adults are more prone to nocturnal leg cramps due to reduced flexibility and changes in nerve function. Factor number 8. Pregnancy. Hormonal changes and increased pressure on nerves during pregnancy can lead to leg cramps. Chapter 2. The top 6 foods to prevent leg cramps. Want to stop leg cramps before they start? Science points to these 6 powerhouse foods that supply the necessary minerals to keep cramps away. 1. Bananas. A classic source of potassium, which plays a role in muscle function and nerve signaling. 2. Spinach. Packed with magnesium, which helps muscles relax and prevents overactive contractions. Spinach can help prevent fatigue-related cramping caused by anemia or nutrient deficiencies. 3. Sweet potatoes. Sweet potatoes can help prevent leg cramps primarily through their high potassium content, which supports proper muscle function and electrolyte balance. 4. Salmon. Rich in omega-3 fatty acids and magnesium, which reduce muscle inflammation and aid relaxation. It's a rich combination of nutrients that support muscle function and electrolyte balance. 5. Avocados. Loaded with healthy fats, potassium, and magnesium, essential for muscle recovery. Avocados help with muscle cramps through their rich electrolyte content and nutrient density. 6. Greek yogurt. A great source of calcium and protein, which help muscles recover and function properly. Greek yogurt helps reduce muscle cramps through its electrolyte content and nutrient profile. Chapter 3. Lesser-known scientific prevention methods. Besides diet, scientists have uncovered some surprising ways to prevent leg cramps. Number 1. Pickle juice shot. The high sodium content can quickly correct imbalances and stop cramps within 90 seconds. Pickle juice is believed to reduce leg cramps through neuromuscular reflex activation and electrolyte support. The vinegar in pickle juice stimulates nerve receptors in the throat or stomach, sending signals to the nervous system to halt overactive muscle contractions. Number 2. Cold showers or ice baths. These reduce nerve overactivity, which can contribute to cramping. Cold showers or ice baths help relax muscles and improve circulation to prevent nighttime cramps through vascular and neurological mechanisms. Cold showers should be paired with stretching, hydration, and electrolyte replenishment for comprehensive cramp prevention. Number 3. Foam rolling and stretching before bed. Foam rolling and stretching help reduce leg cramps through mechanical release, improve circulation, and neuromuscular relaxation, addressing both acute relief and long-term prevention. Studies show that foam rolling post-exercise decreases delayed onset muscle soreness, lowering cramp risk. Nightly calf and hamstring stretches reduce cramp frequency and severity, as shown in a randomized trial. Number 4. Vitamin B6 and B12 complex. Studies show that B vitamins, especially B6 and B12, support nerve function and reduce cramps. Vitamin B6, pyridoxine, and B12, cobalamin, help reduce leg cramps through neuromuscular support, nerve repair, and metabolic regulation, as evidenced by clinical studies and mechanistic research. Number 5. Compression sleeves. These help improve blood flow and prevent muscle fatigue that leads to cramping. Chapter 4. Why do leg and foot cramps happen at night? Nocturnal leg cramps often occur because muscles are slightly shortened when lying down with feet pointed downward. This position may trigger spasms in already fatigued or tight muscles. Additionally, reduced blood flow during rest periods could exacerbate cramping tendencies. Abnormal nerve firing, as suggested by electromyographic studies, may trigger nocturnal leg cramps. This could be linked to hyperactive motor neurons, sending involuntary signals to the muscles. Conditions such as diabetes, kidney failure, or peripheral artery disease can increase the risk of nighttime cramps. Medications like diuretics and statins may also contribute by causing electrolyte imbalances or nerve irritation. Chapter 5. What to do immediately if you get a cramp. If you get a leg cramp, don't panic. Here's what to do immediately to stop it. 1. Stretch it out. If your calf cramps, pull your toes toward you to stretch the muscle and massage the area. 2. Apply gentle pressure to help the muscle relax. Cramps involve abnormal motor unit recruitment, with some studies suggesting peripheral nerve terminals or muscle fibers as initiation sites. Pressure resets this hyperexcitable state. 3. Apply heat or cold. A warm towel relaxes tight muscles, while ice numbs pain and inflammation. 4. Stand and put weight on it. Standing shifts body weight onto the cramped leg, forcing the calf muscle to stretch as the heel remains grounded and the knee bends slightly. Walk slowly to engage muscle coordination and reduce tension. While massaging your calf muscle, grasp your toes and bend them up toward you. Stretching interrupts the hyperexcitable state of motor neurons responsible for involuntary muscle contractions. Leg and foot cramps can be painful, but by understanding their causes, eating the right foods, using science-backed prevention methods, and knowing how to stop them fast, you can keep cramps at bay. If you found this video helpful, hit that like button, subscribe, and share with someone who needs this info.